The world is constantly changing. We live in the era of information society. The internet connects the people. The development of science is focused at the cosmopolitan dimension of mankind. The technological development is becoming a part of our everyday living. The global science is becoming more available to people. The information society becomes a part of our everyday life. A new principle of transparency has been established. Internet transparency means education and communication. That is actually the principal objective of every humanistic priority. In accordance with the new standards, medicine, as a science, along with its practical part, has turned to information and education. There is no more important thing of the mission of medical science than it is meeting the objectives, and the main objective is prevention. It is the key element in decreasing the number of deaths by a brain stroke by at least 50%, decreasing the number of deaths resulted from cardiovascular diseases by 40%, and decreasing the number of death cases in children by 25%. The prevention consists of the education, the prevention and the basic health literacy, but how can we reach for that? The answer is simple, as long as you use the internet as a tool. The human race is integrating by social networks and other types of communication. One of the most effective form is the video games. More than 650 million people Google the keyword game on a monthly basis. More than 90% of people actually use that word, and the average age of people playing video games is 33 years old and is increasing. We're not going to talk about the pros and cons of video games because there is some balance between the two of them. This means that some aspects of playing a video game influence people in a positive way and they are recommended by the medical community, whereas others are not. In fact, if games are played in a reasonable rate, then they have positive effect on people. However, the video games are the visual, but also the universal language of communication. People who play video games represent a large number of the population. As an integrated group of people, they represent an accessible area in which information on health prevention can be transmitted. The best results will be obtained by conveying short, concise, and essential messages. The main idea is to transfer the information on medical prevention to people in the simplest way, without interfering with the focus of their interest. If they want to know more about a certain topic, there will be a link that will guide them to a page where the etymology, prevention, development, and treatment of a certain disease will be described. It might seem weird at first the way the medicine and the video games could be associated one to another, but then people who play video games represent a large target group. The focus of contemporary medicine is to create video games that will help people get acquainted with certain diseases. In order for the project of medical education and games to be applied completely, there is a need of the support of the public sector, the private sector, and the non-government sector. We call on the sectors to unite in a joint mission, that is to support this project, since health is a top priority. This connection between the medical education for the prevention and the video games as a media will lead to a unique, innovative, and modern way of raising the awareness.